Hello, Uganda. Mwanguzi Shadrach from Health Touch Uganda. Today I'm going to be talking about constipation. Many people experience episodes of constipation every now and then. Constipation, I mean not going to the toilet as normal people do. For example, in a week you go to the toilet less than 3 times, and even when you go, you pass out hard and dry stools. You use a lot of energy, you strain while passing this stool. Sometimes you even feel pain. Sometimes it comes with some blood. So those are some of the things we look at and be like, probably this person has constipation. So in this video, I'll be addressing some of the common causes of constipation. I'll also highlight some of the other things that accompany constipation, and among those things, I will be telling you which ones should force you to seek health care as soon as possible. Then I'll also talk about some of the things you can do at home to prevent and treat constipation. So, like I've said, some people take a lot of time without going to the toilet, and this causes a lot of discomfort. In some, they start feeling abdominal pain. When they eat, they eat something very small and they feel like they've eaten a lot of food. They go to the toilet and they spend hours and hours and still come back when they are not even happy. They still feel like they want to go to the toilet, or their abdomen is still full, but when they go, nothing comes out. In some, they can obviously feel that there is something blocking the passage for the stool. And constipation can take place in any people. Fine, there are categories where the risk is increased. For example, in the elderly, people above 65 years of age, people who are pregnant, people, the young children, they are at an increased risk of getting constipated. But anyone can get constipation, because some of the causes of constipation can include even other people. So, what are some of the things that commonly cause constipation? One, I will say your diet has a very, very big role it plays in the ease you find while passing stool. There is a food component we call fiber, and it's found in foods which are commonly got from plants. For example, vegetables, fruits, the seeds, all those plant-based foods contain a high amount of fibers. So these fibers play an important role in ensuring that you pass stool with ease and also prevent this constipation. So if the kind of diet you're on, or the kind of food you usually eat, doesn't have enough fibers, or doesn't have part of those food components are broken down for you, it means you are at an increased risk of developing constipation. The foods which have low fiber content are especially derived from animals. For example, milk, the meat, the cheese, and other animal products have a lower concentration of fibers. The processed foods, they all have a lower concentration of fiber. So if those are your kind of foods, it means your risk of becoming constipated is higher, in conjunction with the other risks I talked about, like age, being pregnant, being a child, and so on. The other is dehydration. Dehydration, I mean when you don't have enough water in your body. There are conditions which cause dehydration, but the commonest is not taking enough water. There are people who go for a day, 2 days, 3 days without taking water, or without taking fluids. So it means you are at an increased risk of becoming dehydrated, and every time that happens, you also stand a chance of developing constipation. People who drink alcohol, people who take a lot of caffeine and caffeine-containing foods also stand a risk of being dehydrated, and when you get dehydrated, you stand a chance of developing constipation. There are other conditions, we call them underlying illnesses, which can predispose you to getting constipated. For example, people who are diabetic, people who have stroke or who have developed stroke, people who have Parkinsonism, which some people call in a certain culture Parkinsonism. You can have your intestines developing pockets where you find, if this is your intestine, it has developed an accessory pocket, or it has been widened abnormally to the point that some of the food gets into this other pocket instead of going through the entire canal up to where you release it. So if in some people there can be a twist, or there can be any form of obstruction. So if you get that obstruction, it means the stool will not be able to flow normally. My point is, there can also be underlying illnesses that cause constipation. Not being active. People who don't do exercises are also at an increased risk. People who travel long distances are at an increased risk. People who usually change their lifestyles all of a sudden are also at an increased risk. So those are some of the things that predispose us to developing constipation. When you get constipated and you start passing blood in the stool, I'm now talking about the things which should force you to go to hospital or any medical facility for urgent medical attention. When you are constipated and you start passing blood in the stool, when you feel a lot of abdominal pain to the point that you don't even want to move, you don't want to shake, every time you turn you feel a lot of pain, and if you feel a lot of pain while passing the stool still, it is important that you go to a health facility and seek medical attention. If you realize that the constipation is coming along with a decrease in your body size, a decrease in your weight, it is also important that you seek medical attention. If your constipation lasts for more than 3 weeks, even when you have not experienced some of those things I've mentioned, but you've spent 3 weeks with that constipation, it is important that you also go and seek medical attention. So what are some of the things that you can do at home to prevent and even treat constipation? Like I talked about the causes, it will be important for you just to reverse whatever I talked about. For example, take adequate water. If you can take 3 or 4 glasses of water in a day, that is good to start with. If you can take other drinks, even if it's not water, but other drinks, I'm not talking about alcohol. In fact, if you can avoid alcohol, because we said caffeine, alcohol all cause dehydration, which dehydration now causes constipation. So I'm not talking about alcohol. For alcohol, please avoid, because it as well predisposes you to other medical illnesses and complications. I'm talking about juice, I'm talking about other flavored drinks, I'm talking about water. If you can increase your fluid intake, that will be very, very good. If you can increase your fiber containing foods, I talked about foods like vegetables, I talked about fruits and other plant-based foods. They all contain a lot of fibers, and fibers will soften the stool and will ensure most of it is passed out with ease. If you can reduce your low fiber containing foods like the milk, like the meat, like the cheese, processed foods, it will also be good because they favor constipation. If you can exercise at least for 2.5 hours every week, for you know, for all the 7 days I have got time to exercise for 2.5 hours. You may not exercise for 2.5 hours at once, but You can spread this time out and know maybe in a day, this is the amount of exercise I'm going to do. It also be very important. There are drugs we call laxatives, which you can get from a pharmacy. If you have had this constipation disturbing, you've tried those other things, you feel a lot of discomfort, you can pass via a pharmacy and get those drugs. Just tell them, I have constipation, please find me something. But I want to caution that it's not good to use these laxatives for a long time. You cannot use them for more than 2 weeks constantly. It is not good. Your abdomen, your intestines will get used to these laxatives to the point that when you have not used them, you will not be able to pass stool. So the most important thing is modifying your diet, modifying those things or doing those things I have talked about. And if you have not got any relief, visit a nearby health facility, because there might be need to do certain tests and confirm the actual cause of your constipation. Mwanguzi Shadrach, Health Touch Uganda, follow the light.